Assalamualaikum warahmatullahi wabarakatuh. I'm Nur Aulia Atira binti Zulkifli, metric number 1910930, and I would like to present the proposal of final year project titled Is there an association between refractive error and dry eye? First, we need to know what is refractive error. Refractive error occurs when the eye is unable to focus light appropriately onto the retina. Based on the photo, there are three types of refractive error, which are myopia, astigmatism, and hypermetropia. As we can see here, in the normal eye or known as emmetropia, the light rays entering the eye sharply focus on the retina. So, emmetropic person can see image clearly without distortion. The next is myopia. Myopia is the medical term for nearsightedness and it occurs when the eyeball is too long or the cornea's curvature is too steep. So the light rays entering the eye do not come to a sharp focus onto the retina. Instead, they focus in front of the retina, producing a blurred image. On the other hand, astigmatism creates distorted or ghosting vision, which caused by an unusual shape of the cornea. Light that enters the eye is distorted and refracted to multiple focus points within the eye instead of the one focus point onto the retina. Lastly, hyperopia is the medical term for farsightedness. This occurs when an eye is too short or the cornea curvature is flat. Light rays entering the eye do not come to a sharp focus onto the retina. Instead, they focus behind the retina, producing a blurred image. Next, we also need to know what is dry eye. Dry eye is a disorder of the tear film layer due to the tear deficiency or excessive evaporation, which causes damage to the intrapalpebral ocular surface and is associated with symptoms of ocular discomfort such as irritated eyes, red eyes, burning sensation, and itchiness. The tear film consists of three sublayers, which are mucin layer, aqueous layer, and lipid layer at the top, which protects the eye from evaporation. And the tears is very important to provide lubrication, reduce the risk of eye infection, and wash away foreign matter in the eye, and keeps the surface of the eyes smooth and clear. So, when the tears is unstable or evaporate excessively, this can cause dry eye symptoms to occur. Now, we move to the literature review of this study. First, let's take a look on the prevalence of refractive error among university students. Based on research conducted in AIMST University Malaysia, the prevalence of refractive error among university students is 32.24%, in which 87.6% were found to be myopes and 7.3% were hypermetrop. University students usually do extensive near work and also prolonged usage of gadgets such as smartphones and laptops, which might be the causes of refractive errors among university students in Malaysia. Next, the prevalence of dry eye in Kuantan area. According to Abdul Rahman et al. 2018, the total prevalence of dry eye disease at Jalan Hospital Eye Care IIUM Kuantan was 48.8%, which is greater than the global prevalence estimates of 7% to 34%. This indicates that there is a high prevalence of dry eye in Kuantan area. Next, we look at the association between refractive error and dry eye. According to the research conducted by Fahmi and Al-Darwesh in 2018, NIBAD and TMH assessment revealed that both myopic and hyperopic patients had considerably decreased NIBAD value of less than 10 seconds, which indicates dryness in 61% of the subjects compared to emmetropia. Moreover, it is also supported by the study from Ilhan et al. 2014, which found that 60% of patients with high myopia experienced significant symptoms of dry eye, indicating that they had ocular surface irritation. This suggests that there is an association between refractive error and dry eye symptoms. On the other hand, there are reasons why refractive error can cause dry eye. In myopia, according to Chang et al. 2001, there are changes that occur in the anterior surface of the cornea as the eyeball elongates in myopia progression, which included flatter corneal curvature, decreased corneal thickness, as well as decreased endothelial density. However, the mechanism of hyperopia inducing dry eye is still unknown. Next is refractive area questionnaire. The refractive area questionnaire used in this study is based on the research from Gamiro-Filho et al. 2013. This questionnaire is a standardized, self-administered questionnaire with 30 questions, of which 26 of the questions are multiple choice questions. This questionnaire was previously tested on first-year physiotherapy students at the State University of Londrina, who were asked about their epidemiological characteristics, whether they had myopia or other refractive errors like astigmatism, hyperopia, or presbyopia, and the correction methods that they use. This questionnaire is chosen in this study because it is not only able to identify the types of refractive error that patient has, but it also has the ability to obtain the degree of the refractive error that patient is having, types of refractive error correction, family history of refractive error, average screen time and meal work span per week, and also history of refractive surgery. Thus, a lot of information can be obtained from patients through this questionnaire. The next questionnaire is Dry Eye Questionnaire, which is OSDI questionnaire. OSDI is a 12-item questionnaire that evaluates dry eye symptoms and their impact on vision-related functions during the past week. It also consists of 3 subsections including vision-related function, ocular symptoms, and environmental triggers compared to other questionnaires, which only assess symptoms perceived by patients. According to Schiffman et al. 2000, when comparing individuals with dry eye disease to healthy people, the OSDI has a high specificity of 0.83 and a moderate sensitivity of 0.6. Therefore, OSDI questionnaire was chosen in this study since it is the most often used questionnaire in the clinical study of dry eye disease. The problem statement of this study is the association between refractive errors and dry eye symptoms has not been fully investigated in Malaysia. Moreover, there is also no available information regarding how hyperopia can cause dry eye symptoms to occur. So the aims of this study is firstly to identify the prevalence of refractive error and dry eye in Year 1 Kuliah of Allied Health Sciences students. Next, to investigate the association between refractive error and dry eye symptoms among Year 1 Kuliah of Allied Health Sciences students. And lastly, to compare dry eye scores between hyperopia, myopia, and ametropia students. And the hypothesis of this study are higher refractive errors is associated with higher symptoms of dry eye. And the dry eye symptom scores are higher among those with refractive errors compared to ametropia. This study used a cross-sectional study design. All Year 1 Kuliah of Allied Health Sciences students will be given 2 questionnaires, which are refractive error and dry eye questionnaire, which is OSDI questionnaire, and they will be asked to complete those questionnaires. The questionnaires will be distributed via email, QR code, and online messaging platform, which is WhatsApp. And lastly, the OSDI scores will be compared between myopia, hyperopia, and ametropia students. And statistical analysis will be conducted in order to determine the association between refractive errors and dry eye symptoms. Statistical analysis in this study will be conducted with IBM SPSS. Analysis of variance ANOVA is used to compare dry eye scores between myopia, hyperopia, and ametropia, and the linear regression also will be used in order to investigate the association between refractive error and dry eye symptoms.
This is the dummy table for statistical analysis. This is the ethical approval form. Ethical approval for this study will be obtained from IIUM Research Ethics Committee. As this study includes human beings as a subject, the informed consent form will be given to the subjects prior to answering the refractive error and OSDI questionnaires. This is the informed consent form used in this study.
Lastly, the expected result of this study is the higher the refractive error power, the more severe the dry eye symptoms. And it is also expected that dry eye scores in myopia or hyperopia students are higher compared to ametropia students.
This is the Gantt chart used in planning and managing every task that need to be done in this study. Last but not least, these are the references that has been used.
That's all from me. Thank you.